On the 13th of March, President Trump issued a national emergency. And on the 26th of March, only 2 weeks later, the United States led the world in confirmed cases of COVID virus. And unfortunately, New York City became the epicenter of the virus globally. So in that 5 months, worldwide, the virus exists in 177 countries. There's 5.7 million cases and 353,000 deaths worldwide. The good news is that 98% of the cases have been mild, but we've certainly heard the stories about the 2% of the severe cases and unfortunately the deaths that have been really affecting our elderly population and folks with underlying health conditions. In the United States, we have 166 million cases and 98,261 deaths to date. That's 5 times more cases than the next leading country, which is Brazil at the moment. So for here in Connecticut, it's taken only 2 months since we went from getting our first case to now we have 41,000 cases, 3,700 deaths, and almost 700 people in the hospital today. We've tested about 225,000 members of our community. Another piece of good news about that is only 18% of the population is positive for COVID-19. So 82% of those tested are negative. We don't know yet. There's so many things that we don't know yet about the virus. Do people have underlying immunities from being exposed to other flus or other coronaviruses like the common cold? If you get COVID, will you get it again? We don't have answers to those questions. But all of these things have required a mobilization nationwide and here in the state of Connecticut of a broad series of health actions taken by the governor. And between March 10th and May 21st, the governor's issued 45 executive orders to keep us all safe, to slow the spread of the virus, to flatten the curve, as they say, so that we don't overwhelm our hospital systems. And one of the consequences of that is that our economy has come to a screeching halt. So currently in the United States, there are 30 million unemployment claims. We have 531,000 unemployment claims here in the state of Connecticut alone. That's about 1/5 of our Connecticut population. I saw a survey this morning that said, this is a nationwide survey that said 49% of Americans have lost some of their income. And 36% of small and medium-sized businesses won't survive if these social distancing rules will stay in effect through October. And when businesses do open, 70% of those businesses intend to hire back fewer employees than they had before the virus struck. So here in Darien, we've been doing many things, and I will say that it is a big team approach to addressing the coronavirus, not only from a public health perspective through our Darien Health Department, our emergency management team. We met back in early March to begin the preparation plans for how to address the coronavirus. And we talk every day about what we need to do to support our community. We also came together with our nonprofit sector. I'm really pleased. Some of you might participate in the Human Service Planning Council. Every week we get together with our not-for-profit providers and determine what areas of support we need to mobilize around. And it's an incredible team of people organized under the Community Fund of Darien. And big shout out of praise to them for really being by our side to help town government manage this crisis. We have also partnered with the Darien Chamber of Commerce and our Small Business Association representative, Christine Sullivan. Some of you might know her. She has been amazing. She's worked hand in hand with our local businesses and really helped them sort of stay on their feet. We also have partnered with the Fairfield County SCORE organization, and available to anyone on this call or otherwise, they provide one-on-one mentoring for small businesses, and you can find their contact information on the Town of Darien website. We have a trove of useful information for you. If you go to our website, which is www.darienct.gov, there's a red banner at the top of the website. If you click on the COVID-19 link, it'll take you to pages where we have federal resources, state resources, local resources, information about SCORE, information about all of the local agencies that are supporting our efforts. And in addition to that, early on, I realized that a crisis of this magnitude, because it was affecting me too in many sort of emotional ways, it was going to be very hard on the people in our community, especially as we moved into the period of time when we all had to isolate at home. And with that, the whole, the underlying fear that we were living with, not knowing if we would be affected, not knowing if the virus would affect our children and our grandparents and our parents. So I had this idea to put together a series of mental wellness videos, just short little vignettes where people could get some nuggets of information and then get information about where they can get more help if they need it. So I reached out to Ingrid Gillespie of Communities for Action and a dear friend of mine, Maud Purcell of the Life Solutions Center. And together we put together a series of 18 small videos that really span the spectrum from how to help your kids, your preschoolers, your teenagers handle the virus, to inspirational messages from our faith communities, important messages about domestic violence. Many of us don't realize that isolation for some has put people 24/7 in the company of those that might perpetrate violent acts against them. So domestic violence is a really significant unspoken issue during this crisis. So you can find videos and resources on our town website. We've got stuff about relationships. You know, sometimes challenges like this make it very difficult for partners to communicate with one another. And of course, stress and how seniors can cope with the isolation that they clearly must feel. We had to close down our Darien senior program, and that's the lifeline for about 1,500 seniors in our community. So we knew that they were going to need some resources. And then of course, and certainly not least, there's resources there for our healthcare professionals and caregivers. So there's a lot of stuff out there. I know we're sort of barraged every day by information about the coronavirus. But if you need more information, you can visit the town website. You can also go, state has a tremendous website called ct.gov/coronavirus, where they have up-to-date data and all of the state resources available for you. I thought today, since it was just released last night, the governor put out a report that's called the Roadmap for Reopening Connecticut. And with Felicia's assistance, I'm going to share a couple of pages from that report. Again, you can find this report yourself on the Connecticut government website. But this is going to give you a snapshot of what reopening is going to look like. And I'm sure that you know that on May 20th, thankfully, we began phase 1 of our reopening. And Felicia, I don't see the slides.
Okay. Does anybody else see the slides on the screen? Do you see my slides or no?
This is Teresa. I see them.
Perfect. Okay. Well, I've got them in front of me, so we can talk from there.
Okay, and you maybe just tell me what slide to go to.
Yep,
but-
if you would go to page number 5, Felicia, it's titled Initial Priorities for Phase 1 Reopening. We were so glad that on May 20th, we were able to begin to reopen with outdoor dining for our food establishments and some reopenings of our, what they termed non-essential retail businesses. I have to say that I found it very difficult that the government would determine who was essential and who was non-essential through this crisis. From an emergency response perspective, I really understand that, but I think it's very demoralizing for anyone, especially a hardworking business owner, to be considered non-essential. So in phase 1, the state had to meet 7 priorities in order to be able to get to that, that great day. Hospitalizations had to be down over a 14-day period. Widespread testing had to be available to the general public. A contact tracing program had to be in place. That's still in the works. There's some glitches with the state system, but they're working through that. We need to protect the people who are at greater risk for getting a severe case of the coronavirus. 70% of the deaths in the state of Connecticut are in our long-term care facilities, nursing homes and assisted living homes. So it's a priority to make sure that we're protecting those populations, folks that are incarcerated, and then certain other populations who present with, by virtue of their culture or their race, some underlying conditions that put them at high risk. So we need to make sure that we have testing readily available for those populations. We have to make sure that our healthcare systems and our hospitals have the capacity and the personal protective equipment in order to be able to handle the folks that are presenting themselves at the hospitals. And to that end, another unintended consequence of the coronavirus has been routine care. People are not seeking the routine care that they need for heart issues, for cancer treatments. School-aged immunizations are way down, so we have to catch up in that regard before the kids can go back to school. So those 7 priorities have been met, helped facilitate us moving on to open some doors on May 20th. So Felicia, if you would now skip to page 10, please. This is a critical aspect of the reopening strategy, and that is for testing and isolating folks who present with the virus. So a very comprehensive program is being rolled out to test folks in our nursing homes and our long-term facilities, screening both people who are symptomatic and asymptomatic. We now realize that the virus has spread so rampantly because there's a large percentage of our population that actually has no symptoms, but they're carriers and spreaders. We have to continue the testing for our critical healthcare workers and our first responders. And we have to make sure that we are expanding testing capabilities through the use of pharmacies. You probably heard that CVS pharmacies throughout the state of Connecticut, not here in Darien, but in Stamford, I believe, are opening to provide testing to anyone that wants it. And then again, to reach out to those high-risk individuals and high-risk communities. I'll break here before we move on to the next slide, which is slide number 13, to say there's a lot of, I guess, confusion over virus testing and antibody testing. So virus testing is exactly as the name implies. You're either symptomatic and you want to be tested to see if you have COVID-19, or right now, because it's widely available, you can go get a test if you suspect that you might have been exposed to somebody with COVID-19 in the past, but you yourself didn't have symptoms. So That's the virus testing. That's what they call PCR testing. Widely available. We have 2 days in Darien, Monday afternoons and Friday mornings. You can sign up at Murphy Medical Associates if you want to get a test or you want to have members of your family tested. There's no prerequisite for that. You can just sign on and sign up, and you don't have to have had any symptoms. People are now wanting to know if I was exposed, should I not get the antibody test? The antibody test, the CDC came out yesterday and said the antibody test is not a useful tool at this point in time to determine if anyone has any kind of immunity to COVID-19. So it's very useful from a scientific perspective to try and determine on a larger scale if folks have been exposed to the virus, but it is specifically not to be used as a return to work or a return to normal life or a reason to not wear a mask, let's say. But it is important for those who might have antibodies to be identified because there's some great promise with the plasma from folks who do have the antibodies being very helpful to those who are sick with severe cases of the illness. So on page 13 of this report, you'll see that there's a system that's being put in place with testing and contact tracing, where the state will capture in their database people that test positive. Local health officials will do the contact tracing to make sure they reach out to all of the folks that could possibly have been exposed. And all of those people will need to isolate and quarantine for at least, I think they've revised it down to 10 days at this point. It was 14 days, but now it's 10 days. And this is how we are going to continue to protect our community from the spread of the coronavirus. So Felicia, if you go to page 17, please. I think it's really important to know or suspect if you have an underlying condition that might make you susceptible or loved ones susceptible to a severe case of coronavirus. Again, about 82% of us who get it might not even know we have it. It might present itself like the common cold in many cases. But for the 18% who have underlying conditions like obesity, a heart condition, diabetes, immune compromisation, or if you live in a long-term care facility or if a loved one does, and you happen to be over the age of 65, those are all considered to be high risk factors. And of course, the more of those risk factors you have, the more severe the illness could be for you. And I think that's really why we're seeing in our long-term care facilities the tremendous illness and death rates that we are, because as we know, folks in those facilities tend to have a number of these conditions. And I think, I think some of you on this call who are healthcare professionals likely also understand that as a nation, America, we are not particularly healthy population. We've got an epidemic proportion of diabetes, which is a specific risk factor for COVID-19. So Felicia, if you would turn to page 23, please. We can look very briefly at some of the economic impacts. I certainly don't want to suggest that that the economy and making money should at all be a consideration higher than public health. But we do have to recognize that with the devastation to our economy, there will be unintended health outcomes that will cause suffering and death unrelated to COVID-19. So you can see on this slide that GDP is down almost 5%. We've got 35,000 businesses closed, over 500,000 unemployment claims. And many of the economic impacts have been driven by our school closures. And I'll take a minute to talk a little bit about that. The CDC put out some guidelines the other day about what opening public schools might look like in the fall, if in fact they do open in the fall. Those decisions haven't been made yet. Very difficult. Classrooms will have to be smaller in class size, all the desks facing one way, separated by 6 feet, PPE worn by everybody, even children ages 2 years old and over, certainly by all the staff. So I am going to give a lot of credit in advance to our public school professionals and our teachers who, by the way, have done an amazing job with e-learning, along with all of you parents. But I think school's going to look a lot different when it does reopen in the fall. And I think it's going to give a lot of people great pause. So Felicia, if you would flip to page 28 for me, we can just review what phase 1 of reopening has looked like. Many people don't realize it, but Connecticut was one of the states that kept a lot of industries open. If you go to, I want to say it's Executive Order 7H, you'll see a whole laundry list of the essential businesses that were outlined by Governor Lamont that had to keep functioning while we were shutting down all of our considered non-essential businesses. So manufacturing, construction, real estate, hospitals, of course, any of the ancillary businesses that served hospitals and manufacturing, all stayed open through the entire crisis. But on May 20th, we opened restaurants for outdoor dining. Some non-essential retailers opened. Offices could open with very strict guidelines in place, 50% capacity and all sorts of entry rules for the public. Outdoor museums and zoos and some outdoor recreation. And I'm particularly happy to say that finally next Monday, the hair salons will be opening. I'm in desperate need of that. But the salons, nail salons, and other personal service care providers, those will come in later phases. It's that close personal one-on-one contact between client and provider that really poses great health risks to people utilizing those services. So if you would go to page 33, please, Felicia, we can see what phase 2 is going to look like. Phase 2 is, there's a couple of things that have to be firmly in place in order to move on to phase 2, which is a June 20 thereabouts opening. Transmissions have to continue to decline. This testing and contact tracing protocol has to be firmly in place. The business regulations and social safeguards have to not only be in place, but have to be evidenced to being followed by everybody who is reopening. Again, continuing the protections for our critical and at-risk individuals, and to make sure that we still have appropriate healthcare capacity while we're bringing back all of those services, those elective surgeries and all of the things that were put on hold for several months. On page 36, just a quick reference that if you're interested, on the ct.gov/coronavirus website, you will find something called sector rules. And these are guidance documents for all of the different business sectors, retail, museums, offices, restaurants. It's all there to guide you. And what I find great to do is they're easy to read. I skim through them all and I look for the commonalities, and you can get a good picture of all of the things that you need to do to open your business in a safe manner. So let's see. I gotta find my phase 2. Bear with me for just a moment. Phase 2 go? Okay, well, I'll talk through phase 2. So phase 2, on or about June 20th, is going to allow for expanded outdoor services. Pools will begin to be open. The salons will begin to be opened. Gathering sizes will be raised from what it is currently still at 5, even though our neighboring states are at 10, I believe. And over the holidays, New Jersey let people gather in groups of 25. We're still at 5, but we'll go to 50 on phase 2. And then a minimum of 4 weeks after June 20th, they will consider moving on to phase 3, which will include a further reopening of all those businesses, expansion of outdoor activities to 100 people, and really beginning the groundwork preparations for what school reopening might look like in the fall. All of that to say, with the giant caveat that if there is a resurgence of the virus, we're going to walk back, or the governor's going to walk back all of these, the loosening of these restrictions. So I encourage you all to take a look at that document. It's got some really good guidance. I think that's all in terms of that document that I wanted to share with you. So Felicia, you can opt out of that. And with that, I think I would love to take any questions that you might have.
So if people have questions, they can either put it in chat or they can just, Karen's waving. I don't know if you have a question. You can just unmute yourself and ask a question. Go.
Yeah. So Jayme, can you talk a little bit about what the rule is with wearing masks in public? Because
Yes.
it seems like when I was out this weekend, when I was in Dunkin' Donuts, I was in Upper Crust, you know, there were numerous people who weren't wearing masks. I was wearing masks. And it seems like the store owners don't feel comfortable. You know, they're trying to get up on their feet, and I completely understand that. But clearly on the doors, it says you must wear a mask when you come in. They're not comfortable saying to people, you know, it says no service without a mask. They're not comfortable saying to the people, you know, you need to leave without a mask. I'm uncomfortable that people are in a store without a mask. So there's this, you know, push and pull, but people are out without masks. What's the, you know, what's the stand? Because you clearly put out your call that said you're supposed to be wearing masks, but kids are out not wearing masks. People are not wearing masks. So
Yep.
what's
Thank you.
what's your take? What's your stand on it?
I really appreciate that question.
Yeah. And then also, what are store owners to do? Yeah.
So a mask, the best practice is that a mask should be worn, or a cloth face covering. We want to make sure that we reserve the special masks, the N95s, for our healthcare workers. Surgical masks seem to be in good supply. As a matter of fact, we are distributing them as a town. The state's distributing those to all of our small businesses. And we've done so to our small businesses for that very reason, that if someone comes into their business, that they have a surgical mask to offer to those people so that they don't have to turn away any potential clients. The rule is that when you are in public, if you cannot distance by 6 feet, you should be wearing a cloth face covering. There's a lot of latitude in the governor's order, though. It does not require that if you have a health condition that precludes you from wearing a mask, for example, if someone has asthma or suffers a bit from claustrophobia, if you have a medical reason why you can't or shouldn't wear a mask, you don't have to, and you don't have to prove that, your health condition. So the best practice is, if you cannot socially distance or physically distance by at least 6 feet, you should be wearing a cloth face covering. It's a tough thing for a business owner. They should feel empowered to be able to share with folks walking in the door, not being mindful of the health and safety of the other patrons or the employees in that business. I hope that they will begin to feel comfortable to turn people away or ask them to cover their nose and mouth. But you maybe can understand why they've been closed for a long time, and many of them are really struggling. So I think that things will get better over time. Certainly hard for kids to get them to understand the rules. That's where parents come into play, making sure that they understand their responsibility to teach their children. So that's really the rule on masks. If you're out taking a walk, or you're out running, or you're out biking, and you can stay at least 6 feet away from other people, you don't need to wear a mask. I see people driving in their cars with masks on. You don't need to do that. But if you're going to be within 6 feet of another person that's not a member of your household, then you should have a face cover.
Great. Heitza had a question. She said, are the 18 videos that you mentioned earlier on the Darien CT Gov website? And
Yes, they are. If you go to darienct.gov, and if you go to under Government and Services, go to TV 79, click on their on demand link, and you'll find all 18 of those videos. And I really do have to give a shout out here again to TV 79 staff, the Darien Foundation, and DAF Media, who helped produce all of those videos for us. They were fantastic. So take a look. There's one, the first video that we kicked off in that series was a video by Rabbi Cohen. And I encourage everybody to watch that, because he is such an inspiration that it's, whenever you need to get lifted up, watch that video. Great.
Okay, and then she also asked, Heitza asked, could you say more about tracing and contact? Is it Contact CT, Heitza, or?
Yeah, I think there's a program called Contact CT, but I'm not sure what it's about.
Yes, that is the electronic program that the state has put in place that's going to be managed by local health departments. So when an individual, all positive cases get reported through the state health department. And once the local health director receives the report of the new positive case, their staff will reach out to the sick individual and do all of the tracing, find out who they've been in contact with for the last week, and then begin that outreach to those individuals and ask them to isolate and quarantine. And that program is called Contact CT.
And then Kate Yuri asked a question. Do you have any suggestions for getting people back into your business? Any tactics for making them feel comfortable about shopping again? Also sidewalk sales, things like that.
Sure. So the governor gave local municipalities the ability to approve all of the tents that you see outside for outdoor dining. At the same time, he gave permission for us to approve outdoor sales for retail businesses. So we're in the process of beginning to see applications for our small non-food related businesses to set up outside. So I'm kind of hoping that we have a sidewalk sale atmosphere for most of the summer, with people doing at least some of their sales outside. When I was out and about on May 20th, many of our retailers have done a great job. You walk in the door, there's a tray there with hand sanitizer, with masks if you don't have one. Some have gloves for those people that might be more comfortable wearing gloves. So I think our local retailers are doing a phenomenal job to make people feel very comfortable. Our clothing retailers, the rule of thumb is that you can go in, you can try on clothes in a fitting room, but then the retailer has to either let those clothing pieces sit for 48 hours or steam clean them before they put them back on the shelf. So that should also serve to keep people feeling comfortable about shopping for clothes.
Have you, just as a follow-up question, is there any wording that you're finding is making people feel particularly comfortable? I'm sort of in the marketing branch, so it's kind of like when you're talking about your online presence is, you know, words like sanitation or limited spacing. I mean, all the things I know we say, but you have the inside scoop, and obviously we want as many people to return to our businesses as possible.
Sure. I think sanitation, disinfecting, just the idea, I've always believed this. One of the challenges that, I'll digress for a moment, one of the challenges that I had through this, the period of closure, were some of the essential businesses that were allowed to stay open, like Walmart, Target, and they were allowed to stay open because they sell food and they sell pharmaceutical items. So that makes good sense. I believe that our small local business people care more about our health and safety and the health and safety of their workers than some of those big box stores do. So yes, I think cleaning, sanitizing, and just having those amenities available when you walk in the door, that tells people that you care. And I think it's great, and everybody's doing it. So we should keep that up.
That's very helpful. Thank you.
Yeah.
And Leslie Lawrence asked, does Darien have any plans? Sorry. Does Darien have any plans to close roads for outdoor seating? I realize that the Route 1 is impossible, but are there opportunities to expand elsewhere?
We've been thinking about that, and I'm sure most of you know our downtown. Unfortunately, we have, Route 1, a state road that runs right through us. And, we only have a few number of roadways that come off of the post road. So we haven't been able to identify any places where we could actually close a road to expand restaurants and shops into it. But we are going to be utilizing our sidewalks. I'm open-minded to utilizing our municipal parking lots. If we wanted to set up like a Saturday bazaar, if retailers were interested in doing that. There is an opportunity in the Goodwife Shopping Plaza to close one of the roadways so that the restaurants in there can expand into the roadway. They're looking at doing that. But we're open to any ideas that any business owners might have, and we're turning those applications around very fast because we know it's important to help out as much as we can.
I typed my question, but Felicia told me to unmute and ask it. I just wondered, any thoughts to maybe limiting how many people can go to the beaches? As the summer gets really hot. Other communities in New York and such have said 50% capacity at the beaches, and just wondering whether there's any thought, Weed and Pear Tree can really only handle so many people at one time. And I just wondered whether there's any thought on us maybe limiting how many people can be down there, and whether we might want to think about, and I don't think this is very complicated, but sort of a shift system where, there was a 10 to 1, a 1:15 to 4:15, a 4:15 to 7:15. So a sort of 15-minute system where, it had to clear out, you had the 10 to 1 and, everybody had to clear out at that time. And then the 1:15 to 4:15 shift could come in so that, nobody could go down there and kind of squat for the entire day. And, once the 50% capacity hit, nobody else could get into the beach for the day. Just sort of a thought that then the whole town really would have the opportunity to in different shifts, be able to go down and enjoy the beach. I just worry that at some point the beach is going to fill up, and, if pools do or do not open, not everybody has a pool. I do think the beach is going to get really crowded, and it's 6 feet apart. It's going to be difficult come the hot weather.
So thanks, Karen. We talked exhaustively about the beaches. And as you know, I closed the beaches for a while. I closed the beaches for a while because it was the young people that were gathering. The teenagers and the kids home from college that were not following the gathering and distancing rules. The adults were always doing the right thing, and we spent a lot of time researching that. So we have now hired enforcement personnel who travel around not only to our beaches, but to our parks to make sure that people are, if they're not from the same household, sometimes it's difficult to know, that they're distancing themselves properly. And for the most part, people are following those rules. We reserve the right at any point in time to change the policies as needed. And we're keeping a very close eye on how people are managing themselves at our beaches. But you know, being outside is super important. It's a healthy thing to do. We want people to use our beaches. It all comes down to whatever policies you put in place have to be able to be managed. I don't see us going to a system of giving people time slots. That doesn't really fit conveniently into the lives of people. But I can assure you that if folks become relaxed in the rules about distancing, we will take additional measures to either limit the number of people at the beaches. It's not the number of cars. You'd have to count the number of people coming in. And since you can walk in, you can bike in, you can have a car full of people coming in, you have to have somebody there with your clicker counting the numbers of people to make a limitation on people be effective. So we're keeping a close tab. The Darien police is down there along with our enforcement agents. So I think that for the moment we have it well in hand, but again, we'll change the policy as needed.
A couple more questions.
Yep.
Maureen, and you guys are welcome to unmute and ask the questions too, but so just to confirm, are nail salons opening on June 20th also? Or?
They should be opening on June 20th, yes.
Okay, and then the same question was about when are you allowed to start using hair dryers at the salons?
That's a really good question, and that's not in the guidance, so I'll have to try and find that one out.
Okay, I know that was a big discussion. I remember on one of the
Yep.
State one. Okay, Annie asked, how many people in Darien have been tested, not the PCR test, and what is the average cost?
So we don't have an exact number of the number of people that have been tested in the town of Darien. We know that we have 202 positive cases of the virus in Darien, 15 hospitalizations, 5 deaths, 2 of those deaths from long-term care facilities. Darien residents can be tested anywhere, so the state hasn't reported to us at a municipal level the number of tests by town that have been given. So there's no way for me to tell you that.
Jayme, it's Teresa. I had a question, and I know this is so difficult for you, but can you give us a little bit more information on school openings, perhaps the decision-making process and timeline, and if it's likely that they may not open if stats worsen? And also, you mentioned a little bit about classrooms 6 feet apart, students wearing PPE. Just anything you know would be great for all of us parents.
Yeah, and you know what, I'm probably not the right person to ask that question, Teresa. I know it's top of mind for everybody. What I can tell you is based on the CDC guidelines that came out about opening schools, which you can find if you go to the CDC website. Summer school was going to be allowed to open on July 6th. I understand that our local Board of Ed made the decision last night to not open summer school. They're going to run it virtually. And the reason for that is at least partially because of the onerous restrictions that the CDC has put in place for in-person schooling. In addition, there's going to be modifications to bus protocols, how many kids can be on a bus. And that will require some management and strategy changes on the part of the district. So I know that our superintendent has his hands full between now and the projected opening of public schools. It will be widely publicized. You will hear about it because it's top of mind for everybody. But as we learn information, we'll make sure that the Board of Education puts out that information to the public.
Thank you.
You're welcome.
And then I know we're wrapping up. It's almost 1 o'clock, so I don't want to keep you, but there's a couple more questions. Maybe Amy Kaiser asked, when will the pools in town be open? I think you said June 20th.
That should be yes, that should be phase 2.
And will they be limited to a certain number of people?
No guidance on that yet. that's the problem with the phase 2 and phase 3 guidance. There's some rough outlines of the things that should be opening, but we know that the closer we get, there's going to be details about all of those things. So I could very easily see where there will be limitations placed on the numbers of people allowed in a swimming pool. I believe municipal swimming pools, we don't have one sadly, but municipal swimming pools can be open now. It's all of the private clubs and the YMCA pools that have to wait until phase 2.
Okay, well, thank you so much, Jayme. It's obvious that there was a lot of questions here. I think this is the HAYVN halftime that lasted the longest with questions, so a lot of interest. And, you know, hopefully we can have you back again another time too. And I know you're super busy, but, you know, someday hopefully we'll see you in the space too.
Well, it was my pleasure to join you. There's so much information out there. So if anybody walked away and still has questions, please don't hesitate to reach out to me. If I don't know the answer, I'll find the answer. And we are here to help all of our small businesses and our nonprofits to be successful in this unusual time. So I really appreciate the opportunity to be with all of you today.
Great, thank you.
You're welcome.
Thank you so very much for coming.
You're welcome.